The 20,000 series consists of surgical procedures performed in musculoskeletal system from head to toe. Especially these areas includes head, neck, back and flank, spine, abdomen, shoulder, arm, hand and fingers, pelvis and hip, leg, foot and toes. 20,000 code series. Question number 1. A physician performed the following trigger point injections. 2 injection into the flexor carpi muscle, 1 injection into the extensor carpi muscle, 3 injections into the triceps brachii, 1 injection into the biceps brachii. What is the correct code for these injections? So there are 20,000 code series are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is a trigger point injection. 2 injection, 1 injection, 3 injection, 1 injection. So 2, 3, 6, 7. So altogether 7 injections. So let's see how to code these injections. So when you see the answer, all are 20,500 and something. So 553 and 52 are there. So you can use the elimination method to find the answer quickly. So let's go to the code directly. So if you go to the code 20,552 and 53, you can see 552 is injection single or multiple trigger points, 1 or 2 muscles. Here 1 or 2 muscles. The 553 is single or multiple trigger points, 3 or more muscles. So this code itself coding for 3 or more muscles. And also the explanation says here, do not report 20,552, 20,553 in conjunction with 560, 560 for the same muscles. For imaging guidelines performed, other codes are used. So in this case, there are 7 injections, but this code itself says 3 or more muscles. So you no need to code separately for the additional muscles. This code itself says 20,553 is 3 or more muscles. So you can directly find the answer, that is B. So this answer itself code for the all 7 injections we have given. So if you're using this case in a real working scenario, you have to go with the alphabetic index. When you go to the alphabetic index, go to the injections, there you will find trigger points. So there it will say 1 or 2 muscles, 20,552, 3 or more muscles, 20,553. Then go back to the tabular list, then you can confirm the answer. Question number 2. A patient suffered a comminuted fracture of the right arm due to a crush injury. The physician implanted 3 pins in a single plane above the fracture and 2 pins and 1 wire along the same plane under the fracture location on the humerus of the right arm. What is the correct code for this service? There are 20,000 codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, the fracture is comminuted fracture, and you can see the above there are pins inserted and below also pins inserted, but all are inserted in the same plane. This is very important part. The wire along with the same plane. So you can see the answers 20,690, 962 and 690, 692. Those codes are available. So you can use the elimination method to find the answer quickly. So let's go to the 2690 code. So before that, you have to understand what is the single plane or multiple planes. So when you see if there's any comminuted fracture, it can be fixed using a external fixation. Here you can see it's a single plane, only one plane. We have inserted the pins. But in this case here, you can see that there are different planes. They have inserted the pins. So in this case, it is a same plane or the single plane, right? When you see the code 2690, it says application of a unique plane, that is a single plane, pins or wires in one plane, unilateral external fixation system. So in this case, you can see we have inserted the pins and wires in a same plane. But this code doesn't mention what are the number of pins or what are the number of wires. So any number of pins or wires, if it is used in a single plane, unilateral external fixation, the code 2690 can be used. If you see the adjacent code 692, it says application of the multiplane pins and wires And 693 says adjustment or revision of external fixation. 694 says removal under anesthesia. So there's no additional notes to mentioning the number of pins or wires. So in this case, the code is 2690. That is one code for unique plan external fixation, irrelevant to the number of pins we have used. So the correct answer is A. So if you use the same question in a real working scenario, you have to go with the alphabetic index. So in the alphabetic index, go for the external fixation device. There you can see application, then go for external fixation. They are multi-plan and unique unit plan. So this unit plan, that is 2690, is the code. So you can check with the tabular list. So in that scenario also, you can find the answer A easily. Question number 3. A patient with a torn medial meniscus underwent an arthroscopic diagnostic procedure via the anterolateral portal. During the arthroscopy, grade 2 chondromalacia was observed on the patellar aspect of the patellofemoral joint and was subsequently debriefed using a 4 mm shaver. The medial compartment was then accessed, revealing a complex posterior horn tear of the medial meniscus, which was probed to delineate its extent. A meniscectomy was performed, removing the torn portion back to a stable rib. Which CPT codes accurately represent the services provided? So there are 20,000 code series are available. So please pause the video for a few seconds, take your CPT code book and find the answer.
3, 2, 1.
So this is a tricky question. There are two procedures. Actually, the procedure started as the diagnostic arthroscopy, but ultimately it went into the meniscectomy. So here we have to highlight torn medial meniscus, arthroscopic diagnostic procedure. There we have found grade 2 chondromalacia. For that, debrided using a 4 mm shaver. The medial compartment, there was a complex posterior horn tear of the medial meniscus. So it was probed to delineate its extent. A meniscectomy was performed. So here the surgeon started this case as the diagnostic procedure as arthroscopy, then ended up with meniscectomy. So here if you see the codes 29,880, 81 and 79. So there are adjacent 3 codes available. So don't waste your time with the index. Directly you can go to the elimination method and directly go to the code. So when you go to the code 879, 880 and 881. So 879 says abrasion arthroplasty includes chondroplasty where necessary or multiple drilling or microfracture. 880 that continues with the 79 that says with meniscectomy, medial and lateral, including any meniscal shaving, including debridement or shaving of articular cartilage. 881 says with meniscectomy, medial or lateral, and the same description there. So with 880 and 881, the difference is 880 is medial and lateral, but 881 says medial or lateral. So in this scenario, you can see the case is started as the arthroscopic diagnostic procedure. So you can see arthroscopic diagnostic procedure and ended up with meniscectomy. So meniscectomy is in the posterior compartment. When you read this, revealing a complex posterior horn tear of the medial meniscus, which was probed to delineate its extent. A meniscectomy was performed so in the medial meniscus. So you can see medial or lateral. So in this case, there's no two parts, medial and lateral, but in this case, it's using only the medial or lateral. So that is medial. So the 29,881 is suitable. So in this case, you can the correct answer will be 29,881 because the tear was in the medial meniscus and a meniscectomy was performed. Shaving and debridement of the patellofemoral joint is included in the primary procedure as indicated by the code descriptor, even though there were different compartments of the knee. The surgery has started out as the diagnostic procedure, but that changed when the physician decided to perform the surgical procedures on the knee rather than only examining the knee for the diagnostic purpose. So in this case, the 29881 is correctly mentioned the procedure. So the answer is D. So if you're using the alphabetic index, that is the real world scenario, you can go for the arthroscopy. Then the arthroscopy change into surgical procedure, not only diagnostic. So you can go to the surgical. There you have to go for the knee. So in the knee is indicate the code series. Again, go back to the tabular list. There you can confirm the correct answer is 29881. That is the answer D. So this is a tricky question. One or two tricky questions may appear in your real exam, not the whole questions. So you don't panic or don't worry about this type of questions. There are 2 or 3 questions will be available like this. So be ready for the worst scenarios also, so you can easily do your exam. One day following an upper leg surgery, a 45-year-old male patient presents with serious drainage from the surgical site. He is taken back to the operating room for exploration due to a suspected hematoma. Upon exploration, a hematoma is found at the base of the wound. This hematoma is carefully evacuated and the wound is irrigated with antibacterial solution. Which CPT and ICD-10-CM codes should be reported for this encounter? So there are both CPT and ICD-10-CM codes are available. So please pause the video for a few seconds, take your CPT and ICD-10-CM code books and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is a follow-up leg surgery. So one day after following up the leg surgery, patient developed hematoma. Then hematoma is evacuated, irrigated with an antibacterial solution. The surgery done on the upper leg. So these are the things you have to note. So when you see the codes, you can see 10,142 codes are there, and 27,603 and 301 codes are there. So here you can use the elimination method to find the answer. So let's go directly to the code on the CPT code book. Okay. When you go to the CPT code book, 10,140 is incision and drainage of hematoma, seroma or fluid collection. So in this case, it doesn't mention any site or any place. If it is so, we have to take it as the superficial hematoma IND, that is incision and drainage. If you go to the code 27301, that is incision and drainage, deep abscess, bursa or hematoma, thigh or knee region. So you can see in the bracket it says for incision and drainage of abscess hematoma superficial, see 10,042, 10,160. So this one is in the superficial region. Here it says incision IND, hematoma, thigh or knee region. So here you can see the case is upper leg. Upper leg means above knee. So that is thigh. So this code is suitable, 27301. If you see the code 27603, that is incision and drainage, leg or ankle, deep abscess hematoma. Here the site is leg or ankle. But in our case, it is upper leg. So this code is not suitable. So in this case, this 27301 code is the suitable one. So you can see all the 4 answers, one having that code, that is 27301. So you can omit all other 3 answers and you can get the answer D before you are checking the ICD-10-CM code. So the correct answer is D. But here you can see there is a modifier used, 78, 79, 76 are used. The previous day patient undergone the surgery, but the next day the patient admitted due to the complication of the surgery. So this is an unplanned return. When you see the modifier 76 is the repeat procedure, but 77 is repeat procedure by another physician. Modifier 78 is unplanned return to operating or procedure room. So this is the modifier you had to use, 78, because this is the unplanned return to the operating room. If you say 79, that is unrelated procedure, but this is related procedure but unplanned return. So the modifier 78 is needed. So if you want to check the ICD-10-CM code, you can see the M96.840, that is post-procedural hematoma of the musculoskeletal structure following a musculoskeletal system procedure. So post-procedural hematoma. So that also describing clearly the condition. So this is the elimination method to find the answer. But if you are working in a real world scenario, you have to check with the index of the CPT and ICD-10-CM code. So if you go to the CPT code book index, go to hematoma, there you have to go to leg and upper. So it will refer you to the 27301. When you go to the ICD-10-CM code, you have to go to the hematoma post-operative, that is post-procedural. You are directed to see the complication post-procedural hematoma by side. So it will ask you to look for complication post-procedural hematoma musculoskeletal structure following musculoskeletal surgery. It will lead you to M96.840. Then you have to go about the tabular list and need to verify. Type of questions may be given in the exam with the CPT and ICD-10-CM code. So most of the time you can find the answer with the CPT code itself, and you have to verify the ICD-10-CM code, finalize the answer. Question number 5. A physician took an impression of a 47-year-old woman's left orbital socket and created a custom prosthesis. What is the correct code for this service? So there are 4 20,000 series codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, this question is a straightforward one. Here you can see left orbital socket, a prosthesis is implanted. So you can see the answer 21,076, 77, 88 and 89. So you can use the elimination method to find the answer. So you can directly go to the codes. So the code 21076 says impression and custom preparation, surgical obturator prosthesis. 21077, that is orbital prosthesis. 21088 is facial prosthesis. 21089 is unlisted maxillofacial prosthetic procedure. In this case, it is clearly says left orbital socket prosthesis. So this is the orbital prosthesis. So you have to code this 21,077, and also this is left side. So you have to put the modifier LT to indicate the left side. So the correct answer is B. If you encounter this case in a real working scenario, you have to go to the CPT index. There you have to go for the prosthesis, then go for orbital. It will redirect you to the 21077. Then you have to go to the tabular list and check. Or else you can directly find the index orbital prosthesis. So you can directly find the code 21077. Again, you can go to the tabular list and check. Okay, let's move into the sixth question. A 37-year-old woman notices a lump in her left lower abdominal wall. A large 6 cm tumor was found on the CT scan along the musculature of the abdominal wall. This was removed and found to be a desmoid tumor. What is the code for this procedure? So there are 22,000 series codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
This is also a straightforward question. So here you have to notice tumor size is 6 cm. Also the tumor is the desmoid tumor. So this is an intramuscular tumor. When you check the code 22900 is excision tumor soft tissue of abdominal wall, that is subfacial, example intramuscular, less than 5 cm. So in our case the tumor is 6 cm. So the next code is 5 cm or greater. So the suitable code is 22901. If you check other codes 22902, that is excision tumor soft tissue of abdominal wall subcutaneous. This says subcutaneous, but our case is intramuscular, so that is desmoid tumor. So these two codes are not suitable. In this case, the tumor size is more than 5 cm. So the correct answer is 22901. That is answer B. So if you use the case in a real working scenario, you have to go to the CPT index book. There you have to go for the index of excision, then tumor, then abdomen. Then it will redirect you to the 22900 to 904 code series. So you have to go to the tabular list and find the answer. So the correct answer will be B. So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.